Abusa mene mo kasa ide honorable health minister ababontene aba responding to nsema Ghana registered midwife and nurses association omo PRO nsema na ko kan ye na say dia tem na ko di no health minister ababontene aba responding na nsem ben na health minister e kan nyabotere jiwa ko nyana mecheche nsem ni mu enfanche recently na Ralph kofobai okọ eye Ridge Hospital achese ko ye video bi a video no ehun nsem ye bebre health minister ababontene a press conference I will check say in some course or Ridge Hospital or no. Just a 1 team Jinan Cranum to Crane into a investigation team of a Tanaso as share no crab a war in Simonimu. You want who say Ghana registered nurses and a midwife or more association no PRO about Bontina Bay interview no mono with the health minister at him.
In this statement, no, it was not captured here, say, or more air for me committee, but subsequent interviews, the minister can say, we're putting a committee together to investigate in Samoa a course. No, Adiabako striking me in this statement, and they said, ministry said they want to investigate the circumstances that led to the reported delay in care. Now, just say most members in our hospital may have contributed to the course. No,
I've taken my the first thing okay, at least first, third, and fourth point. It makes sense. And now, and quite a say, what are the security implications? Why do you have to be proper behind country? They can't say, well, I mean, they are trying to beef up internal security. The police, they have a police post close to the mortuary and all that. All those people were there, and I started when you see it. And you know, the security situation has not been improved, and we are not happy about that. At the time, here my tiny second point, no. Minister, who said there are systems over there. If he doesn't understand, he should get somebody to educate him. Anytime I catch say triage system, so they are yes, Obi, don't buy house. Maybe can't buy into the shame.
Yeah, Doc, I get you, but I think because
triage, Nia, who said, oh yeah, Reno, a immediate care, and I say a delayed care as compared to others. If you are no immediate care, they will attend to you immediately. So by time others, and I say they will neglect you. They will give you first aid or whatever, but they will attend to other people who need more a year. It doesn't mean that they are delaying whatever. So that statement doesn't make sense to me at all. It doesn't make sense. Whoever wrote that statement doesn't even understand the hospital system. Or farmer another day. What kind of life is that? Mania, you are called disaster when you you told your boss I am for statement. Sunday, no, your man go for call, and then right man go for to call, and then you are any hospital directors now for what delay? Now, what banner a month for you that whole getting a such a base of car near Yenya? We are anybody why? No, you know how I say there is system delay. What kind of delay? There was no such delay. They went strictly by the lay down protocol. And then just Ralph Omu. Now that's what you are. Obvious near fracture based scar near Hena. What's your Yamaho? Then there you the minister. See, what is even more annoying is what the minister did. His statements ran contrary to his poster. Okohona Ralph now. Onuatv and phone. Embrace. Look at the pictures on social media. He affectionately embraced the rap guy, somebody who has been fingered as the perpetrator of that heinous crime. You embraced him, and then the guy whispered into his ears, and he was smiling. Whether it was setting or whatever, how did the guy go to know that the minister had come there? I'll rush about her immediately.
Yeah, Doc, I get your point, but I just wanted to draw your attention, sir. In all of this, no, it is the Minister of Health we are talking about. Indeed, some of the statements, no, might sound a bit too harsh. As far as Oyewo sector minister, you should be minded by that.
I agree with you, Obi, but you see, Papa, how can you treat nurses like this? It's a case of disrespect. You go and embrace the very guy, and not let me look. Initially, no, he was being defended. So, management. It's not true.
And so one of my interviews for SHM say one more almost social media so omudidi nurses ne doctors atem no ene NDC for na omudidi nurses ne doctors atem no mama ke omunyina no mbeche omunyansa so ba hospital we nsema PRO no eba abontene ebe kan na ndeye wo and then who say honorable health minister akoye interview with TV3 na interview no mu no na wo che mu say PRO no or the apology be bawo won fam bo on the nya na sem sebi eyen kwase asem na papa ni di da bi kwase asem de me na me hye ho no eyen kwase asem na papa ni di ti nya ade a wo no obe respond to eye sa ansem na eye PRO no ba bonten be kai na mpo se duru apology na se ka se yen be apology I say emfa ma wo no health minister na on the nya na sem so me bawo so mo bawo on the nya na sem because ohunu say adwuma na yi ne so mrambe ye no.
That's where I'm going with that. For a union that you have worked closely with since you came into office, for them to come out and pass such a remark, how did you feel about it?
Well, I had a lot of feedback, but I feel that is not the important thing. I shouldn't consciously ignore.
Should they apologize to you?
I don't really care whether it's up to him, whether they will apologize. That is not my aim. That's not my target. You see, the distinction, this is about communication. And the perception, the work we do is all about perception, okay? And sometimes I reflect back, there are issues I should have spoken to, I let it slip. Maybe immediate advice, I let it slip. But they slip and die with a certain perception. They die all right, but they die with a certain, and that is why in this case, I address the press to state the issues, to state the facts. And I think I'm right, because after the press conference, I had a lot of feedback. Okay, and so, somebody is positioning you as a leader, inciting people against you. Okay, making it look as though even the incident that happened, you even caused it. That is how it's going to be put out there in the public domain. Not for people to recognize the effort you are putting in. And you keep quiet, you sit back. No. But he's not my target. The leaders are not my target. My target is the ordinary Ghanaian, the 33 million people, the over 100,000 nurses. As for the leaders and whoever said that, their motivation is up to them. And that is not the first time he's doing this. You work with TV3, and you know some of the comments they've made in the past and all that. That is not my worry. That is not my marching orders from my president. So that one, let's ignore it. And let's look at what the sector holds for us. So for me, I will continue to work with them. Okay? Work with all union members and make sure that we have a health sector that is affordable, that is accessible, that is equitable, and that we can have sustainability and sovereignty.
So by next week, we will know the outcome of the committee's work.
I'm very sure.
Despite your intervention in this matter, we know that the nurse in question has sued RAF, I believe, for some 7 million cedis for the damage done to her. What are your thoughts about that?
That's fair. Let's allow the law to take its own course. I don't need to comment on this matter. Once it's sued and it's in court, I'm a minister. Let's leave that for the courts.
Very well.
And I wish anybody, any Ghanaian, if you don't understand anything, the appropriate forum is to go to court.
How long will you keep the police at the
regional hospital? We'll have an arrangement with the police going forward. And you see, so these are some of the things. When issues happen, they shape government policy direction. So now I'm beginning to reflect not only on Ridge Hospital, I'm looking at other health facilities as well. How can we beef up security on every district hospitals? So now we are going to look at how DCs and district health directors will link up with the police, whether superintendents or district commanders in their various jurisdictions. And we have that kind of collaboration to be able to assess them as and when. So these are some of the things you will have to. When issues come, you learn. It guides, it shapes government policy going forward. And so we will have that collaboration, whether to even allow the police to take charge entirely or to increase our own internal security or something. We have missed something.
So, I mean, in your at your first-hand visit to the situation, what did the nurses say was the reason the patient had not been attended to yet?
Okay, to be honest with you, there was some kind of explanation offered because, of course, the minister has come, so they will try to explain those issues. But I don't think that is for the consumption of the public from me. especially so when I've constituted a committee to look into the matter. Of course, they tried to give me, maybe they didn't even know I was going to constitute a committee. So they tried to explain what really happened, especially the medical superintendent. They tried to run me through the incident. But once there's a committee, I don't want to go into that matter.
All right. Then I guess by next week we'll know what the
yes, I've given the maximum of 1 week. So I'm very, very sure by the end of the 1 week, the report will come out.
Away from that, let's look at the infrastructure and equipment gaps that bring up some of situations such as this. What is the NDC's infrastructure plan as far as the health sector is concerned?
So at the moment, the status is that we have about 6 teaching hospitals. We have about 10 regional hospitals, and then we have about 9,000 CHIPS, health centers, and district hospitals. That is the status at the moment. So what we are looking at is that how can we increase their accessibility? We are looking at constructing not less than 2 CHIPS compounds in a year in a district, 2. And then there are other health facilities under construction that are ongoing. So His Excellency has directed a percentage in the disbursement of the common fund to also take care of those ongoing projects. And so we have a collaboration between the Ministry of Health and the Ministry of Local Government to supervise, to equip, because after the construction, you must equip the facility, basic equipment. You must also staff it, personnel. So there's that collaboration. We are supervising. Immediately we finish, we have to equip it and then put in personnel to run. And then district hospitals, especially district without hospitals at all, we'll look at them. We will not start 111 hospitals at the same time. We will not do that. I will take them gradually. We are even looking at, I've told you we have 10 regional hospitals, right? Now, it means that we have a deficit of 6 regional hospitals because we have 16 regions. So we are looking at building those 16 regions at least for the next 4 years. So district without district hospitals at all, we'll look at how we can, especially if something of that nature has been started already as part of the Agenda 111, we'll prioritize those areas. And once you're talking about infrastructure, let me bring in the Agenda 111.
We'll talk about that in a bit, and we'll do that when we come back from this break, because I want us to have a lot of time to be able to do that before another break.